everyone, Lisa DiFalco OT here, and class is still in session. This course that we teach, the Boca Lymph Lift of the head, neck, and face, is one that just brings up so much information, and we thought we'd share it with you. This is the crowd surpriser in the class, which is a picture of a nose that's cut in half from the top to the bottom. And you're like, oh, that's gross. Well, this person actually had skin cancer, which started out with something that looked like just a tiny white head that turned out to be actually basal cell carcinoma. And I know that client, and I can use her name because you're looking at her. That's my nose that you're looking at. And I've been an MLD practitioner specializing in working with plastic surgeons for the past 2 decades in Florida, never thinking for a moment I was going to be the patient. But now I can say I'm so thankful for the skills I have, and that's why I love teaching it too, because some of you who are my students who've heard this story went out and got your own skin tested and found out that you too were in need of the Moh'S procedure to remove the cancer, and then use the lymphatic drainage to help minimize the scarring, the bruising, the swelling, and accelerate that healing time. And thank you for sharing that with me, and I'm glad I could share it with you too. Just a little word about it. When I went to my surgeon at Memorial Hospital West in Fort Lauderdale, Florida, he gave me what I knew would be the standard procedure that would be all-inclusive of having the surgery, going in, taking portions of the cancer out, sending it to pathology until the borders and margins were clear. And in my case, that took almost 8 hours. We had to go in 3 times. Why I'm telling you that is because it meant we had to go in pretty deep, and I'll spare you the details. But the doctor did forewarn me. He says, you're probably going to swell really bad. You're going to have bruising under your eyes. You're going to have scarring, and we may have to look at doing a scar resection in about a year. And I said, Doc, I know I'm familiar with this kind of thing because I work with other plastic surgeons, but the benefit of manual lymphatic drainage helps to accelerate the healing process. And he got interested in what I was saying because he was familiar with it from lymphedema, but had never seen it put in action for a Moh'S procedure, which that was his specialty. So we did a case study. I allowed him to take pictures and everything because he too is an educator. And it turned out to be a wonderful event. What was, I guess, what you call having lemons? We made lemonade. And it was a cross-educational event for both of us. But he got the chance within just 5 days in my healing and recovery to see my nose go from that to this, without all the lymph fluids sitting there getting thick and hard and ropey and scarring. There was no need for a scar resection. And his funny comment at the end was, wow, is there a billing code for that? But we laughed together, we learned together, and we want you as patients, as therapists, if you are having issues on your skin and they're unresolved and they're bothering you, can I just encourage you as a friend, as a teacher, go and get the work done. Just take care of it this year, and know that lymphatic drainage could be one of those modalities that helps you to recover from any surgery when it's physician recommended. So here you are at the MLD Institute International. For more information, you can visit us at our YouTube or on our Facebook, mldinstitute.com, or on our website. Look forward to seeing you.